Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a very informative show you won't want to miss tonight. We're talking about diabetes and heart disease, how they're related, common causes, risk factors, and steps you can take to decrease your odds of developing either disease. We'll discuss lifestyle and medical management options, be joined by a panel of the leading health professionals in this field, hearing patient stories of success, and taking questions from our live studio audience. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at diabetes with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have a comprehensive panel of guests today on Health Now. Joining me first is Dr. Bankim Bhatt. Dr. Bhatt is the Chief of Endocrinology at St. Luke's University Health Network. He's board certified in internal medicine and endocrinology and metabolism. He received his medical degree from Eastern Virginia Medical School. Dr. Bhatt completed his residency at Washington Hospital Center and his fellowship at the University of Pittsburgh Medical Center. He has a passion for treating patients with diabetes and difficult to manage symptoms and believes comprehensive diabetes education is the key to good health.
My name is Bankim Bhatt. I'm the Chief of Endocrinology here at St. Luke's. The endocrinology actually affects the entire body because the hormones go everywhere in the body. I sort of take small pieces of what the patient's telling me and put it all together to sort of come up with, hey, what's wrong with this person and how do we fix it? The patient has the biggest role in this whole thing. Diet and exercise is the most important thing somebody can do to help their diabetes. Just in the Lehigh Valley, we're approaching 1 out of 10 people having diabetes. And that's all from our current lifestyle. The education piece needs to start very early. If we educate our children, they will not start getting the disease when they're 20 or 30. I think being part of an institution that's involved in that and is actively working on that is so important, not just for me, but for everybody else who lives in the community.
Dr. Bhatt, thank you so much for joining us.
Oh, it's my pleasure to be here.
Diabetes can be a really complex issue, so before we get started, can you explain to our audience the difference between type 1 and type 2 diabetes?
Type 1 diabetes is where a person doesn't make any insulin, and we have to give them insulin to control their blood sugar. Whereas people with type 2 diabetes still make insulin, but the insulin doesn't work as well, and they're resistant to the action of insulin. Type 1 diabetes usually occurs in young children, whereas type 2 diabetes usually occurs in older people. But nowadays we're seeing it as young as 30 or 40.
Thanks, Dr. Bhatt, for being here. Joining our panel next is Dr. Dennis McGorry. Dr. McGorry is board certified in family medicine and practices in his hometown of Allentown, Pennsylvania, as a part of the St. Luke's Physician Group. Dr. McGorry completed his medical school training at Thomas Jefferson University and his internship and residency at Bryn Mawr Hospital. He's proud to be a part of the St. Luke's team and hopes to bring his patients health and healing through his personalized care.
I think the most rewarding part about our job is when you really make a big difference in a patient's life. We treat many diabetic patients. We initiate a plan here. Oftentimes we are the providers that are diagnosing diabetes. So we'll be the first people to kind of give them the news that they have diabetes, and we'll initiate their plan of action. At our office, we take care of patients throughout the entire spectrum of family medicine. We have newborns all the way through geriatrics. I always tell patients right at the onset, in particular with something such as diabetes, I can add as many medications as I need to control your disease process. But the most rewarding time for me is when a patient takes ownership of their disease process. They come back in, they've lost a couple pounds, they've initiated a new program, they changed their diet, and they've really made some changes on their own. And those are the moments that we call high five moments. And that's what really makes it worthwhile.
Dr. McGrory, you have a big, bustling family medicine practice and you see a lot of patients. What are some warning signs that someone might be pre-diabetic or even diabetic, and how do you address that with the patient?
Well, we're seeing more and more type 2 diabetes developing in our patient population. And there's a lot of things to look for. I mean, there's a family history, there's a lot of genetics involved. Obesity is a big concern. Lack of exercise and poor diet are certainly risk factors for developing type 2 diabetes. Patients oftentimes that when they develop type 2 diabetes will actually start to lose weight unintentionally. They'll notice that they're extremely thirsty and that they'll be urinating quite a bit. And that's actually the body's defense mechanism to try to unload all of the glucose in the body.
All right, we'll get more to how you two work together a little bit later in the show. Let's meet our final panelist, Robin Gale. Robin is a registered dietitian and certified diabetes educator in the St. Luke's Endocrinology Group. She's a graduate of Rutgers University with a Bachelor's of Science degree in nutrition and holds a second bachelor's degree from Albright College in Business. She received her MBA from Moravian College. Robin works closely with both the physicians and the staff to coordinate the best care and educational options available to her patients. She also runs community outreach programs offering patients and their families a variety of ways to fight diabetes.
My name is Robin Gale. I'm a registered dietitian and I am the program coordinator for St. Luke's Diabetes Education Center. I think one of the most challenging parts of my job is showing people that they actually have the power within themselves to make some of these changes. So it's easy to say, oh, watch your diet, but then you leave whatever office you're at and you say, how do I do that? Well, we're there to show you exactly how to do that. I think starting education as early as possible is integral in managing diabetes. We offer many, many different programs. Really, anything that has to do with diabetes, we can provide education so that patients can be empowered and participate in their care. It's wonderful working at St. Luke's. The team approach, I think, is very important because there's really no one piece of the puzzle that's going to make everything right. And we all work together really for the benefit of the patient. We're all in the same boat trying to do the same thing, and it feels really great.
Robin, as a diabetes educator, what is your primary role within the group and how do you approach each patient's needs?
Well, diabetes education, folks come to us and they really learn all different aspects of diabetes care. So we teach them all different things about managing their diabetes through their food intake, as well as the medications that are being prescribed to them, exercise. So I like to say it's like A through Z, how to manage your diabetes. And I think we try to meet the patients where they're at. So it's very important to understand what their values are, what their preferences are, because that's the way to help them make changes, starting where they're at and moving forward from there.
It sounds like this personalized medicine and every patient is unique is so important to all of you. We're going to talk a little bit more about all of these topics as we continue on with the show, so thank you for giving us a better basic understanding of the individual roles that you all play. Coming up, we'll dig deeper into how the panel works together to solve complex medical issues and how diabetes and heart disease are more connected than you may think. We'll also hear from patients and our audience later in the show. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Even though I was big most of my life, I never really worried about my weight. I mean, I'm able to do stuff. I was obviously getting a little older at the time, and I'm taking a lot of drugs as far as for my diabetes and stuff like that, not wanting to stick myself in the needle. And I think it all kind of worked on me. So when I actually got to the doctor, I think I was ready. It was time for a change. Being over 400 pounds, it doesn't take much to realize that you know your weight is what's doing it. I think the motivation was I like where I'm at now. I liked when I started losing the weight, even when I lost the first couple of pounds. I liked that. I mean, I think everything for me has been in St. Luke's. For me, there's no other place. The best part about it is how I feel. I feel so much better than I did before. It changed my life.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being here with us today and providing us with questions, which we'll get to later in the show. I'm joined by a wonderful panel of medical professionals, Dr. Bankim Bhatt, Dr. Dennis McGorry, and registered dietitian Robin Gale. We've discussed their individual roles, and now we'd like to get a better understanding of some of the diabetes treatment options available at St. Luke's. So, Dr. Bhatt, I want to start with you. When a person is diagnosed with type 2 diabetes, what are the first steps that you take?
So when someone is diagnosed with diabetes, the first step that I take is to send them to education, because the more they know about their own diabetes, the better they can manage it. And understanding the disease process, understanding how it works and what can be done to improve it without medication is the first step. And then if need comes up, then we can use medications to control the diabetes better.
So really looking at lifestyle modifications as the first step in someone's potential recovery from diabetes or preventing it getting worse.
That's actually the cornerstone of the treatment of diabetes.
And Dr. McGorry, for you, when you see patients, how do you end up knowing that they need to go see Dr. Bhatt and his team? And then how do you work together with the endocrinology group for the good of your patients? Because you're really the most regular point of contact.
Right. So we're screening our population for diabetes. We're seeing these people routinely. We're diagnosing most people with type 2 diabetes in our own practice. And a lot of times we'll manage the treatment up until a patient has very poor control despite what we're doing, and then we'll refer on to Dr. Bhatt. We will also routinely utilize our nutrition services, because I think that is, as Dr. Bhatt said, the cornerstone of treatment. I always tell patients I have a closet full of medication that I can eventually treat their diabetes with, but until they really take some control, they're not going to do well.
And it shows that it's important for them to really be a part of the process.
Absolutely.
Robin, both Drs. Bhatt and McGorry mentioned education being so critical, and this is your department. So how important is education for a person who is fighting diabetes?
Well, it's important because it empowers them. So really, when you know how to do some things to take care of yourself, it really takes you very far. And so a lot of patients may not realize that they have that kind of power within them. And it can be simple steps to get started, and then once they do and they start seeing the results, then they want to continue forward.
So knowledge really is power, especially
in this case. Yeah.
Absolutely. Dr. Bhatt, what role does lifestyle and exercise play in this? So we've talked a lot about diet and understanding healthy eating, but what about exercise? Where does that come into play, and what's a reasonable amount of exercise to make a difference in someone's health?
So we've learned this many years ago. There was a large study done that actually showed what happens with lifestyle modification. And the study showed that an 8% weight loss and 30 minutes of exercise a day makes a huge difference in terms of prevention of diabetes. So when you looked at people who did lifestyle modification compared to not doing anything, 2/3 of the people did not develop diabetes. That's the most powerful thing there is diet and exercise and lifestyle modification.
Those are incredible results, the kind of results that if a medication showed, right, everybody would take it.
Right.
So this is the medicine.
Right. And truly, this could be the cure for diabetes.
Dr. McGorry, we're talking about lifestyle modification, diet and exercise, and of course you're monitoring patients over the years. They come to you hopefully seeking their regular care. How difficult is this conversation to have with patients, and is there any hesitation on your part or any of your counterparts to discuss this with patients?
This can be an extremely difficult discussion. To discuss a patient's obesity can be something that takes a little bit of getting used to. I think it's important in primary care that we're able to mention obesity, mention the fact that someone is overweight, and do that in a very objective, non-judgmental way. It's very important to be able to address a patient's weight and discuss the risks that their being overweight presents to them in the future. It's important for us to be able to discuss with a patient what their lifestyle is, what do they do as a dietary habits, do they exercise routinely. That is something that we all need to be very comfortable in primary care discussing, and then being able to counsel people or finding someone who can counsel them in their dietary measures prior to them actually even developing diabetes.
I would imagine that once you've had that conversation, at least then the door is open to really get the right education and connect them with the right resources to help them start to fight that battle.
Indeed. It's about discussing resources and getting a patient to buy into the fact that they need some help as they move forward.
Great. Really wonderful information from all of our panelists. After the break, we'll learn more about the role type 2 diabetes plays in heart disease. You're watching St. Luke's Health Now. Stay tuned. Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a great show tonight. We're talking diabetes and heart health. We're also hearing patient stories of success and taking questions from our live studio audience. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Bott, Dr. McGorry, and Robin Gale. Thank you all for being here with us tonight. So in the first part of the program, we talked a little bit about some of the warning signs you might have if you think you're pre-diabetic or diabetic. And then we've talked in the second part of the program about the role that education might play. But this is the thing, diabetes is not just diabetes. It's starting to affect other parts of your body. So Dr. Bott, can you explain to us how type 2 diabetes affects your heart?
So type 2 diabetes has lots of complications, which affect not only the eyes, the kidneys, the nerves, but it also affects the cardiovascular systems. So the people with type 2 diabetes are at increased risk of developing heart disease, stroke, peripheral vascular disease, which can lead to amputations. And that's how the connection is. The other component of diabetes is when you have diabetes, you also have other comorbid conditions or other conditions that go along with it, like high blood pressure and cholesterol, which also affect the heart and lead to stroke and heart attacks.
It really is the kind of disease that opens you up to so many other things that then you have to manage.
That's right.
So Dr. McGorry, when you're managing a patient with type 2 diabetes, what are some of these other things that you're looking for that Dr. Bott started to mention, and how do you manage this from spiraling out of control?
So as Dr. Bott mentioned, there's multiple other factors that come into play. People are at much higher risk for kidney disease. So in that sense, we really need to make sure we control hypertension. We need to make sure they're on a specific type of blood pressure medication called an ACE inhibitor or an ARB, which can help prevent progression to kidney failure. We really need to actually treat someone with even type 2 diabetes as if they almost already had a heart attack. Their risk factors for a cardiovascular event are as high as someone who's already had a cardiovascular event.
Robin, you mentioned earlier in the show that you have to meet the patient where they are. Can you give me an example of when a patient comes in thinking one thing and how many things maybe open up that you need to kind of educate them on, and how do you go about meeting them where they are?
Well, I mean, we start with a dialogue about what their eating practices are right now, so their eating habits. And then from there, we can really identify where some of the problems are. And it could be anything from meal skipping to large portions. And that's where we try to find out what they're willing to do. So sometimes folks aren't willing to give up certain types of foods, or they're not. So that's fine. If the portion's too large, then they can just portion that down. Drinking more water, trying to make substitutes, trying to find happy substitutes. So it's not about them eating a certain way all the time. It's about them finding a way to actually be happy with the diet that they have.
It's a great example of how family and internal medicine works with endocrinology, works with education, really, and dietitians for the patient's needs. You know, Dr. Bott, St. Luke's has embarked, because of this connection with type 2 diabetes and heart disease, on a new campaign, For Your Sweetheart. Tell me a little bit about that.
As we know, people with diabetes who die, 2/3 of them have cardiovascular disease. And the #1 cause of death in people with diabetes is cardiovascular disease. And I think many people don't realize the risk that they're at for cardiovascular disease just because they have diabetes. So I think this education program and the campaign is going to make that more upfront for the community and educate the community. Look, somebody you know is at risk for dying from a heart attack or a stroke.
And it's preventable.
And it's preventable.
You know, you mentioned the community. Dr. McGorry, there are so many things that St. Luke's does to reach out to the community, whether it's Get Your Tail on the Trail, Walk with a Doc, community education events, classes Robin's team holds. How important is it to you to be part of a network that really reaches into the community for prevention?
Right. St. Luke's Network is very dedicated to the community. You'll see at any of our campus sites, we really bring the healthcare to the population. And being involved in a community and programs like Dr. Bott's program are just fantastic to raise awareness of disease processes, to bring patients into our offices so that they may have received the appropriate screening, and ultimately to hopefully prevent these disease processes at home where they live.
Dr. Bott, how important is the communication between all of the physicians and caregivers at St. Luke's for the health of your patients?
So communicating with each other actually gives us the complete picture of a patient. And that's the most important thing to treat a patient. I don't want to treat a number. I want to treat a patient. I want to treat the whole person, not just one disease process. And diabetes is one of those processes, one of the diseases that affects many parts of the body. And that's why communication with all of the providers who are taking care of that patient is important.
Thank you all so much for really an in-depth and informative conversation. We've all learned a lot. Up next, questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thanks to all of our audience members here tonight and our patients for sharing their stories with us. And of course, to our wonderful panel, Drs. Bott, Dr. Mogori, and dietitian Robin Gale. We've had a frank and open discussion on type 2 diabetes and heart health at St. Luke's. Now we're going to take some questions from our studio audience. We got a lot of questions tonight, so let's start with this. What is the best advice, I think this is for you, Dr. Bott, that you can give to a patient newly started on a subcutaneous or diabetic pump? And what is a pump, and what's the advice you can give them?
So someone with type 1 diabetes and sometimes with type 2 diabetes, we start them on what we call an insulin pump. So that's a device that actually gives the person insulin around the clock. And we can change the amount of insulin they get every hour if we wanted to, or if we needed to. In addition to that, they're able to give themselves insulin through the pump when they eat. So they don't have to carry around their insulin as a separate device. It's already on them in the pump. The best advice I can give them is remember to monitor the blood sugars, because with a pump, you're getting an insulin all the time, 24 hours a day, even when you're sleeping. The second best advice I can give them is make sure that when you're using the pump, you should be on a sensor as well. So a sensor is another device that measures your blood sugar every 5 minutes, and it actually tells you what's going on with your blood sugar. It'll tell you if you're getting low, it'll tell you if you're going high, and then you can use your pump to manage that even better.
And it does that automatically even if you're not purposefully checking your sugars.
Correct.
Excellent. Well, that sounds very important then. Dr. Mogori, this audience member asks, what's the best way to raise a conversation with someone you suspect might have diabetes? And you mentioned earlier in the show, you have to do this with patients, but I think they might be alluding to family members or friends. How do you bring that up?
Very carefully. I mean, this could be a pretty difficult conversation. I mean, obviously the person you're talking to is probably doing something that's not healthy for themselves. They're probably not exercising. They're probably overweight. And these are very difficult discussions to have. These people may need to cut back on drinking. They may need to increase their exercise. They probably need to make some very, very significant changes to their diet day to day. And that's an uncomfortable conversation. I think if you care enough about somebody, you might just have to have an uncomfortable conversation. And you know, even if you don't want to have it, I've got plenty of patients, they'll give a call to my office and they'll finally have gotten their husband to come into the office, and they'll give a call ahead of time and say, don't tell Bob I said this, but I'm really concerned about, you know, X, Y, and Z, and we're pretty good about working that into the conversation. Don't ignore it.
Yeah,
That's the
sometimes
biggest
having
thing.
that difficult conversation can really save somebody's life.
It can.
And just like Dr. Mogori said, if you care enough, you have to have that conversation. And that's what this For Your Sweetheart campaign is all about. Right. You care enough about somebody that we want you to be aware.
That's right. That's For Your Sweetheart.
Right.
All right, Robin, I'm going to ask a question from the audience to you. If caught early enough, is type 2 diabetes reversible?
Type 2 diabetes, once you're diagnosed, is a diagnosis. However, you have the option of being able to manage it through lifestyle change and not have to go the route of medication. So there is opportunity to be able to manage it some other way than medication. So
Also,
I don't know if the
in my
doctors wanna-
experience, one of the more satisfying visits as a patient, we've diagnosed them with type 2 diabetes. We have that critical discussion. Maybe we refer them over to Robin, and maybe we decide not to even initiate medication. They come back in 3 or 4 months and their A1C, which is what we're monitoring, is down below the diabetic range. It's essentially a high-five visit. I mean, the patient, it's kind of a victory for both of us, but it's a very satisfying visit. And I would agree that the diagnosis still lingers out there. This person is prone to this disease process, but it is absolutely controllable.
And they have to just be vigilant about those actions that can keep it under control.
Absolutely.
Dr. Bott, this audience member asks, is there a certain age a person should do base testing for diabetes, and what symptoms indicate the need for further tests?
So the symptoms I think we talked about earlier, which is being thirsty a lot, unintentional weight loss, urinating frequently. Some people have blurry vision as well, so they're not able to see when they're driving, or they're not able to read when they're trying to read newspaper. At what age should you start? Well, that all depends on the risk factors that they have. Lifestyle, in terms of what they're doing in their lifestyle. Obesity, particular ethnic group like African Americans or Hispanics are at higher risk. So if you're in those high risk factors, they should be probably doing it when they're 30, 35, 40. If you don't have many of those risk factors, you're fairly thin, you don't have family history, maybe you wait till 42, 43. But I would say at least at 40, start having screening.
Dr. Bott, you lead into the next question from the audience, and I'll ask it of Dr. McGorry, which is that African Americans have a disproportionately higher risk of diabetes. What can we do to combat diabetes in this community? And you mentioned the Hispanic population earlier in the show.
I think mostly it's education, and education based on populations is very important. There are racial biases with disease processes, and it's important for someone who is African American to have some knowledge of their family history. It's important for us to discuss their family history, and it is important for them to have care. And that's an issue that we deal with in some populations, that access to care is maybe not as robust as it is in other populations.
You mentioned education once again, so Robin, I'll end the program with a question for you, which is how would patients or people in the community who are just looking to get some more education or understanding of their risks for type 2 diabetes get that from St. Luke's?
Well, they can easily inquire at their primary care physician's office, especially if that is where they primarily are going frequently for their care. But they can also call the Diabetes Education Center and get the referral very easily from their doctors. So either way, primary care or just call the center.
There's lots of ways for people to get the education that they are seeking or that they might need. So thank you all to our panel for being here, Dr. Bott, Dr. McGorry, Robin Gale, and to our audience, thank you to all of you for being here this evening. For more information on diabetes and heart health at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well. And remember, it's important to focus on your health now.